Hello everyone, very warm welcome to Dr. Shefaly Shares. My name is Shefaly and I'm a nursing and midwifery professor at National University of Singapore. I'm excited for yet another video here for you all. Today I'll be talking about a very generic topic, why nursing? Why I'm saying this? Because often when I am being asked by parents or even nurses who are not nurses yet, or rather student nurses yet, and they are confused that why are we taking nurses, about what nurses they do. So these are some of the, I think, questions I commonly ask, so I thought I'd develop a video on that. Before that, first and foremost, when people ask you, especially when you are already a nurse or if you are somebody who is thinking of becoming a nurse, I think there's a lot of misunderstanding, especially in our Singapore context, on what nurses do. Mostly people have this understanding that nurses work in the clinic and they clean people's, all that, right? So probably you also have that idea if you have never heard or known about nursing, or you as a nursing student, or even after becoming a nurse, people probably think about you like that. So I think especially you are a nurse or already a nursing student, when people have such misunderstanding about what nurses do, and often they say such I would say, derogatory comments around nursing work, I think don't feel sad, don't feel offended, rather take that opportunity to educate people. This is something I often tell people, because I think people share all those things because genuinely they don't know what nurses do. So for all the people here who doesn't know what nurses do, or some of you who are thinking of doing or pursuing nursing in your life as a career, let me just share with you in a nutshell what we all nurses do. I have already developed a video where I have talked about that what are the different tracks of nurses, being an educator, researcher, as a manager, or even doing a clinician work. Yes, nurses' main role, it starts especially when we become a novice nurse or we become registered with the Singapore Nursing Board. Our main role revolves around clinician work, which means we take care of a patient holistically, right from their basic healthcare needs to planning their care, working with the interdisciplinary team members as a very important person, so that because we are spending a lot of time with our patients, so we play a very important part in planning holistic care for our patients. So I think that's something we need to know, because nurses often feel that, I have heard at least from my students, that we can't do much because we have to wait for certain orders to be executed, or even delivered to us before we can actually execute those efforts, or even the plan created for your patients. I think that's a mindset we need to change as nurses before we want to own up, and rather we want to gain that respect from the public. As nurses, we are leaders. We are leaders for our patients under our care. So I think as nurses, we need to remember that how important our role is. In order for us to be our patients' advocates, in order for us to gain our patients' trust, in order for us to gain our public's trust, we need to be our patients' advocates. And how we can become our patients' advocate? By engaging in lifelong learning, by knowing our work, remaining professional, engaging in technology-based quality care, so that when a patient care is developed, we are one of the integral part of that team. So what are nurses' role? They can work as a clinicians, like I said, that's for the first few years, so that we can gain and establish our clinical practice. And then from there, we can think about any particular area or specialization we would like to pursue. I think if I take maybe even 5 hours, I may not be able to cover all the specialization which nurses can do. And if remember, I'm a midwife. People can be OT nurse, operation theatre. People can work in accident and emergency. People can be in a medical specialization, surgical specialization. Palliative care is a new thing now coming in. Community nurse is another one. There are many, cardiac nurse is another one. So there are many areas which nurses can specialize. I can do another video where to think about that, what specialization or how you choose a specialization. But for now, you need to know is that nurses' role is, nurses are patients' advocates. We are leaders in our own work, and we need to remember that we play a very important part of our interdisciplinary team. Without our inputs, we cannot provide holistic care for our patients, and most importantly, we are the voices for our patients. So while doing that clinical work, learning and establishing our skills, we can then decide to specialize whichever area we would like to, and then there we upgrade our skills and contribute whichever area we are working then. And while pursuing and working and upscaling our skills and all that stuff, we can also then decide if you want to remain as a clinician, because as a clinician you can continue to upgrade yourself up to advanced practice nurses. It's a beautiful, another very established field now in Singapore. We commonly, they are known as APNs. These people, some of them can even prescribe medication. They can even run their own clinics. So that's something very beautiful. As clinicians, you can serve and remain near your patients. Or, like I cover in my other videos, you can be an educator, researcher, or innovator. So, in nutshell, nurses play a very, very important role, being as a patient's advocate, being as an important part of the interdisciplinary team, as well as we nurses are the leaders. And if I can just tell you in one phrase, if people say that if doctors are the brain of the healthcare industry, I strongly believe that we nurses, we are the heart of the healthcare industry. So on that note, thank you very much for watching this video. Hope you got some idea on what nurses and their roles are. Remember to continue to watch. Please let me know if these videos are helpful or you want me to cover any other topics. And most importantly, remember to stay awesome.